Yeah, it worked.
Do you feel like you need a forum?
Nice ringtones. Yeah. Okay, so you come in, you're assessing your patient, and your doctor, you come in and you get your report from the off-going nurse, obviously, and she's telling you that this patient is experiencing lung congestion because they have congestive heart failure, history of congestive heart failure, and they have hypertension. So she gave you the report, and she tells you that the off-going, that the doctor has just placed an order for Lasix IV push. Who knows the push time for Lasix?
2 minutes.
Okay.
1 to 2 for 20.
20, it's actually
How much is
20,
one?
20 milligrams per minute. So you have to actually calculate it based on what the order is. So if I had an order for 40 milligrams, what would it be? 2 minutes, basically. So, okay, so we got the order. It's 40 milligrams of Lasix IV push. Before we do anything, we're gonna go in and do our own personal assessment on the patient, right? Because we wanna check for ourselves if there really is lung congestion. That way we know there's a reason to give Lasix. What's some of the side effects of Lasix?
Hypotension.
Hypotension is one. What else?
Arrhythmias.
Potassium?
Arrhythmias? Potassium? No?
Possibly, yeah.
For
Potassium
Lasix,
depletion,
it's like hypotension, hypoclemia.
Right. The patient might have to urinate a lot, potentially.
Basically, the electrolytes get depleted.
Basically electrolytes, and most importantly potassium. So if they're really low on potassium too, that's one of the labs you might want to check.
Right.
So when you come in and assess your patient and you know that you're giving them a Lasix IV push, then you might want to check their blood pressure, even depending on like how much you're giving them. So 40 milligrams, definitely come in, introduce yourself. Hello, my name is Dexy. I'm going to be your nurse today. I just want to listen to your lungs, do a quick assessment because the off-going nurse told me that you're experiencing some shortness of breath. Is that true? The patient says, yeah. They have their pulse ox on. It's like at 80. So you kind of have like more evidence. So you take their blood pressure and it's 90 over 50. Would you question giving?
Yes.
Lasix? Okay. Because you might drop them. But if it's normal, with their normal range, whatever their normal is, because some patients have really high blood pressures because he has a history of hypertension, then you know it's okay to give. So I come in and I'll listen to the patient's lungs. I do hear crackles. Then I know it's okay to go ahead, based on my assessment, and give the Lasix. All right, so when you go into the med room, you are going to check, first of all, your drug guide for Lasix. You're going to check side effects because on the competency, they're going to ask you to sit down on a piece of paper and write out side effects for each of these meds, no matter what they give you. And you check for Lasix and you see it causes potassium depletion, urination, hypotension. You gather all your information, and most importantly, you have to calculate the push time. So with the 40 milligrams per minute, 40 milligrams and 20 milligrams per minute push time, we're going to push Lasix for 2 minutes. Okay, so what do you take from the med room for an IV push med?
Flush.
Okay, normal saline.
Syringe.
Your medication.
Put it on. It's fine.
No, I'm kidding.
Okay.
It's good.
Cool. Yeah.
Okay, I'm just gonna put
Just
some
so
Lasix in
annoying.
here.
I know it's kind of hard. Do I know?
So you have your flush, you have the Lasix, and you
Syringe?
have,
Oh, yeah.
okay, and you have alcohol, and you already checked everything in your drug guide, and you're ready to go, right? Come back inside the room. The first thing you're gonna do is check and see if you have the right patient. And you actually should have done this when you first introduced yourself, because another important part of this competency is having the 6 right down. Right patient, right dose, right route, right time, right reason, right? Reason was congestion. So I'm coming back in the room, checking again that I have the right patient. Okay, I've identified them. Next, I'm going to scan in my medication. That's Lasix. And then I'm going to come back to the patient, and what I'm going to do is make sure that their IV is patent. Right? Because if the medication, if the IV is no good, then I would need to start another one. Okay, so I'm just letting the patient know what I'm going to do. By assessing it, you can kind of tell, well, in a hospitalized patient, would this be a good or a bad IV? What do you guys think?
Bad.
Bad, because it's coming out. But you don't know that for sure yet, right? you can try to flush it and see if it's still flushing. So actually what I did, which totally went really fast, is you have to scrub for 20 seconds. That's the rule for competency, and it should be in the hospital, but some nurses will do like that and then go away. That's not good. It's not good. Scrub for 20 seconds, and then open up your normal saline, attach that, and I should make sure that this is open, right? Pushing, and then nothing's going in, that's not good either. So I'm just letting know the patient that I'm like checking their IV, I'm looking for any infiltration as I'm pushing in. Do you guys know the difference between pushing, how much you flush with a central line versus a peripheral line? No? So central lines are always pushed with 10, always. In the hospital, you may see your nurse push just with like a small 5, not push, but flush or try to check for patency with just a small 5. But in the hospital, if you ever get a patient with a central line, which are the ones maybe that are connected at the neck, sometimes they're connected in the arm too, or down at the leg, arterial lines, then you know you're always gonna flush or push when you're, after you push your medication, you're gonna finish off by pushing a full 10 mLs, always, never 5. Because what they're saying is that it has to reach the heart completely, all the meds, and a 5 is too small.
So for peripheral is 10, and for central is how many?
Peripheral is 5.
Okay.
You could do it 5.
Yeah.
And then central lines are always 10.
Okay.
We're talking about before or after you administer the medication.
Before, if you're checking,
Because
well, I
there's no
mean,
medication yet. Push, right?
for a central line, it's a little different. I don't really know if you're checking placement for that.
But
More so
like-
for a peripheral. But after you're done pushing the medication and you want to flush everything down, it's always 10 mL so that you make sure all the medication to central line is. These medications are going to the heart. Peripheral has it's okay to do 5. Okay. So since I said 5 is okay for a peripheral line, what I can do is go ahead and check the patency. You don't have to push the full 5 to check because we know this patient has heart failure. They might be on what?
Fluid restriction.
Yeah, fluid restriction. So I'm giving this plus additional fluids potentially, then it's kind of like building up. And each time I come in and check, then I'm doing that. So you don't really need to do that for a patient who has heart failure, but for purposes of competency, I would push all the way to 5 just to check it. And meanwhile, I'm like touching it and see if it's like, there's any swelling, any redness. No, I don't see that. I'm not really gonna go all the way to 5, but you guys get the idea. And then go ahead and knock this back meanwhile. And then you're gonna let them know that you're getting ready to push Lasix, and you're letting them know the side effects. I'm gonna leave your urinal if it's a male. I'm gonna leave the bedpan if it's a woman, or bedside commode, just because you might have, increased urge to use the bathroom. But, if you do need to get up for any reason, I can come, I'll leave your call light next to you, and I can assist you to the restroom, because one of the side effects is gonna make you pee a lot. So you could just let them know, and then also you can let them know about, lowering the blood pressure and stuff, just to be safe, because that's fair to the patient. But don't use, medical jargon, because it might scare them. So, all right, so I'm gonna attach after that the Lasix. Lasix. And when I push it, I'm pushing over 2 minutes, right? And I'm using what some people, the start, stop. So you push a little bit over each time. You don't really have to do that. You can just push slowly and look at your watch. If it's a full ml, then you push 1 ml per minute if it's over 2 minutes. But you want to make sure you hold it upright like this so you know that it's absolutely going in at that rate and that you're not accidentally pushing a little bit too fast. So, 2 minutes is up, but did my medication really go in? I made one mistake. What was it?
You don't know the clamp?
It's clamped.
Uh-oh.
That's a rookie mistake.
Mm.
I don't even think it's gonna go anywhere.
Where is
You're
it
just
going
gonna be
then?
sitting there, and it's like,
Off
you're
the
like, what's
IV.
going on?
But you would feel it, right? There would be resistance.
Yeah, you'd feel it, but just just make sure you open it up.
Do you need to scrub it again between
It's okay.
checking the patency and
Chill out tonight.
putting the...
Yeah, you could scrub it. Actually, for competency, it's probably best to scrub it. In the hospital, I feel like if it's been scrubbed for 20 seconds with chlorhexidine or alcohol, then you're not really exposing too much between switching between the normal saline and the drug. But for purpose of competency, after you flush it to check patency, you can scrub again for another 20 seconds. Attach your syringe. You'd attach your syringe first, and then you go ahead and release this. Don't do it before. Just make sure it's locked. Attach this, make sure this is locked, unlock it, and then push the medication for ever how long. And then just show them that, you know, you're looking at your watch and that you're being safe and that you're making sure that you're pushing it at the prescribed rate according to the drug guide. Okay, so I pushed all of my Lasix for this patient. I'm scrubbing again with the new alcohol swab, by the way, for 20 more seconds. And then I can go ahead and flush with the remainder 5 mLs. Okay. Should I just push this really fast? Does it matter how long I push it?
Same rate
As the same rate as the medication, right? So again, 2 minutes, I'm gonna push this entire thing. And I'm gonna actually sit there for an additional 2 minutes, despite what the nurses say. There may be medication in this line, and since we're pushing that medication over 2 minutes, it's only right to push a normal saline, which is also considered medication over 2 minutes as well. So, before I take this off, I'm gonna go ahead and lock this. I pushed the entire thing. You know, if it's taped, just neatly push it, put it on the side, just like that. And then you're gonna let the patient know, okay, you know, just administer your medication. How do you feel? They're not gonna have release of their symptoms right away, but just, you know, out of courtesy, ask them. You could say, I'm gonna come back in 30 minutes and I'm gonna reassess you. Again, I'm leaving the bedside commode right here. If you need to get up, just press your call light, let me know. I can come assist you to the restroom if you'd rather I do that. Or here's a urinal. I'm gonna come back in 30 minutes or so, or whenever you get the time, but you wanna make sure you reevaluate. You're gonna come back, listen to the lungs, make sure the patient is actually urinating, because that's proof that some of the fluid is being released. If my patient has urinated since I gave the medication, that could be a problem, right? Right. There's one thing I did forget to do before I push this medication. What was that?
I see what you're saying.
Okay, that's one thing. But there's a really important thing as far as labs goes.
Potassium.
Potassium. Is this patient's potassium was at 2 or 2.7, and I gave Lasix. What would I have to do?
Yeah.
I have to call the doctor and ask for an order for potassium, which is kind of scary because they're assuming that you knew, or you should have checked what the, you know? So, as soon as they start peeing, those electrolytes flow, and as we know, if this patient is on like a telefloor, we might start seeing, you know, worst case scenario, some arrhythmias, because now I just depleted the potassium, right? So make sure you check your labs, all labs, but specifically potassium. Make sure you check in the drug guide, how fast to push it, calculate it, any side effects, and then make sure you grab the materials that you need, which would be a 5 ml, if you have it, a 10, 2 5 mLs, or a 10, and then the medication and alcohol swabs, right?
Mm-hmm.
Okay, say I was pushing Protonix. How fast should I push that over? And how do you administer Protonix? Anybody's ever done it in a hospital? Okay. How do you? Okay, you reconstitute it. Does anybody know what that means? Joey, want to explain?
Add water, or add whatever the drug guide says to add. I don't know if it's normal saline or
Yeah.
W or sterile water or whatever.
Yeah, so the drug guide says to reconstitute with normal saline. So all you do is get like an 18 gauge syringe, which is, by the way, one of the bigger syringes. And the purpose of that is that if you even try to use like a 20 or anything smaller than that, it's gonna bend, and the medication's not. They literally like bend in there. You know, little insulin syringes, how they just bend really easily. When you puncture it to try to pull your medication out, it's gonna bend and it's just gonna create a mess. So 18 gauge, you're gonna connect it to this right here, and then. Let me see if there's any gauges. I have to ask Angela. So no one's giving Protonix in the hospital?
I've given it with the nurse.
Oh, it's not. You guys haven't done it.
Yeah.
Okay, so you're gonna do a ton this semester.
Yeah.
Yeah, literally, you're gonna do so many Protonixes because everyone I feel like has that. and a lot of them get IV push, so. Okay, so you're gonna attach the 18 gauge. You're going to push all the contents, the full 10 mLs inside. I'm pretending like this just has powder, right? This doesn't have actual liquid in it. This is Protonix. It
That's
comes
okay.
white powder,
Okay.
right? Pop off the lid. It's gonna be a new one. And you can even, since it's new, you don't have to, but I don't know if you guys have actually saw your nurses do something like this, cleaning that off
Yeah.
for insulin and stuff.
Mhm.
Whatever. Well, everyone's been using the insulin, so it only makes sense. But for Protonix, if it's new, meaning the cap has not been popped off, which it shouldn't be, it should come out of the Pyxis or the Omnicell, it's fine to just go ahead and do it. But if you want to be, you know, evidence-based, just scrub that for, I don't know, maybe 10 seconds. Push all the contents inside of this bottle that contains the powder. You're going to like swish it around a little bit, like that. And you're going to draw everything back out until you get the full 10 mils again.
Is that like a one-time use container?
It is.
Okay, because it's not like the others where like there's multiple dosages in one.
Yeah, it's not
Okay.
like an insulin or something that's left in the med room and everyone can just, because once you reconstitute it, you have to pull the
so you don't know how
full.
much is in there.
Right. And so usually they're 40 milligrams in a Protonix bottle. So 40 milligrams is within that powder. So 10 mLs, you're gonna pull that all out, get everything all you need. And before you leave the med room, you're not gonna take off the little. I know that we're giving it IV push, but we're not taking the needle off. Because the needle is actually gonna come off in the patient's room before you give the medication. So when I'm taking this medication to the room, the needle is still attached. And again, I can grab a 5 ml this time since I'm pushing normal saline in this too. And I can grab alcohol swabs. When I come into the room and I assess the course IV, I'm making sure that is patent. Before I push the medication, obviously scrub all that. Then I can take off the needle and I can put it inside of the sharps next to the patient's bed. And then give the medication over 2 minutes. So,
Hey, Car, say that needle part again. So you do you do the whole Protonix next to the patient, or you do it in the med room and then you take
Yeah, you-
the?
I mean, some nurses bring it into the patient's room empty, just to
Yeah.
scan the bottle.
Yeah,
But
yeah.
I mean, you could technically, all this technically should be done in the med room, so that
Okay,
when
yeah.
you come inside, you can just
Mhm.
give it. But what I was saying is that you put the needle off and put in the sharps right before you
Because
give
one
it.
thing they say is like if someone refuses, then you wasted medication. So they're saying
That's
just
true.
do it like next to the patient, so then you don't have to.
That's true. So another thing, good point. Before you even give any med, after you do your assessments, backtrack all the way back to our assessment. You've done your assessment on this patient and you determine that they do have fluid in the lungs. You're saying your doctor ordered Lasix for you, explain what the medication is, but you're also going to say, are you okay taking this medication? And if they say no, they don't want it, then that's the right to refuse. That's a patient right. So, you know, don't even waste your time preparing it and all that stuff. But I mean, even if they say no, try to at least like, you're not forcing them to take it, but you're explaining why it's really important that they have the medication. And you're not just saying, okay, you know, one less job for me. You don't want to take your meds, oh well. You're actually explaining why they need it. So, good job mentioning that. What else did I miss? So,